Take the first bite of flesh going from deep to superficial so that the needle exits from the dermis. And then on the other side, do the opposite, taking your bite from superficial to deep. Since you're both starting and finishing the suture in the deep end, when you tie the two ends together, your knot will be buried as deep as possible and the suture will be invisible from the surface of the skin. It's important to make sure that both ends of the suture end up on the same side of the loop. Now just instrument tie a surgeon's knot, but when tightening the throws, instead of pulling perpendicular away from the wound, pull along the length of the wound, and that will help the skin edges to come all the way together. Add a few more throws to make sure the knot is very secure, but not so many that you leave behind a bulky knot under the skin. Take a final bite going away from the wound and cut the suture material as close as possible to the skin. Sometimes these buried sutures are enough to keep the skin closed, but if the wound is under high tension, what it does is it takes some of the tension off the skin so that when you go to do your more superficial skin sutures, they're better able to perfectly approximate the wound edges.